Welcome to Fun Learn Medicine. These are short 3-minute video takes meant for everyone, whether you are wearing a white coat or a green tunic, whether you are in the business of making a confident diagnosis or anxiously waiting for one. This is for everyone. Stockholm 1958. Dr. A.K. Sennings had a problem. He had a patient who had an extremely slow heart rate, a heartbeat of 38 beats per minute compared to normal of 72 up. And this man won't respond to any medicines. Dr. Senning called up his friend, engineer Rune Elmquist, and drew up a plan. A plan to do something truly drastic. If you look at the heart is supplied by a pair of coronary arteries which carry oxygen-rich blood to the heart muscle for it to function properly. There are a pair of them, one on the right, one on the left. If one of them get blocked, we get what we call as myocardial infarction, heart attack. But we are not talking of heart attack. If we dissect deep down inside the myocardium, we find the heart has an electrical system. Yes, your heart is hybrid. It runs both on fuel and electricity. And that electricity starts from a battery, a generator, situated on the right top corner of your heart, called the sinoatrial node. From that battery, electric current passes over intricate cables to a point called atrioventricular node, from where it gets distributed all over the heart. So your heart needs electrical power and fuel. This is a very robust system, almost fail-proof, but like every system, these two can fail. And that is what we call as electric power failure. Different from heart attacks, electric power failures slow down the heart rate, sometimes can stop it, and people would need an artificial battery to power the heart. And that's what we call as electric pacemaker. Now the problem is the pacemakers available in 1958 were huge, plugged onto an wall outlet. They were not portable. And Dr. Senning's patient was only 40 years old. So he wanted to miniaturize the electrical pacemaker. It was not easy, you see, getting a pacemaker of today's size. You see that pacemaker there, put by a small surgical incision under the skin over the chest. From that huge size, so this small size, it's not simple, right? So shrinking sometimes is not very easy to the size we are talking about. But then they did it. And this was the first implantable portable pacemaker put under the skin of the patient in 1958. The first ever pacemaker. Today, we have 1 million plus pacemakers implanted every year worldwide. 1 million plus. But interestingly, the very first patient, 1958, Arne Larsson. Arne Larsson had his first pacemaker implanted at the age of 43, at the young age of 43. He died in 2002 at the age of 86. And during this 43 years of his life with pacemaker, he needed 22 pacemaker changes. 22 pacemaker generators were changed. Because unlike today's strong pacemakers, the olden days pacemakers were not reliable, they didn't last long. But then here comes the surprising bit. Arne Larsson, the first ever permanent pacemaker recipient, outlived Dr. Senning and engineer Elmquist, the creator of the pacemaker itself. So if you have an idea, if you have a technology that changes life, that can last beyond the creator's lifetime. Thank you for watching and do wait for more.